Sometimes patients who come for major surgery, for instance, of the large intestine, liver, and kidneys and so on, are found to have severe heart disease as well. Most of the time, before proceeding with major surgery, doctors would ask for what we call cardiac assessment, which may involve stress test, echocardiography, even cardiac catheterization. There is a better way though, a safer way, I feel, and that is using CT coronary angiography, or CT scan of the heart, from which we can tell how severe, if any, the heart disease is, and make a decision on to whether treatment of the heart is necessary. Now, so the patient coming for major surgery, and sometimes it can be quite urgent. Of course, in an emergency situation, there's no time to go and assess all these stuff. But sometimes surgery, even though it is not emergency, it's still relatively urgent. For instance, somebody with cancer of the large intestine sac cannot wait for a long time before proceeding for surgery because it may not become operable anymore. So, in such a situation, there are two options. Frequently, cardiologists will think about angioplasty and stenting of the coronary arteries first before the patient proceeds to major surgery of the intestine, or the liver, or the kidney. Now, the angioplasty and stenting can usually carry out usually uneventfully, but sometimes complications can occur. Following the procedure, patients are put on very strong blood-thinning medications, usually two types, and what we call antiplatelet therapy. There is a bit of an issue here in that the patient then proceeds to major surgery, the risk of bleeding is increased because the patient is taking blood-thinning medications. On the other hand, if say, and we normally do advise patients to stop the blood-thinning medications for a few days, maybe 5 days to a week, before proceeding with the surgery to reduce the risk of bleeding. Now, very soon after stenting, there is a significant risk of stopping the blood-thinning medications because the stent can block off, blood clot can form on the stent, which may lead to clotting off of the stented artery, thus leading to heart attack, and sometimes, in worst case scenario, the patient can die from this. And the stress of the surgery probably will increase the risk of this. So, patients are usually advised to wait for a bit until everything becomes more settled, perhaps a month or so. But even then, there's still a risk of stopping blood-thinning medications. The other alternative is to consider a combined procedure of heart surgery and the other surgery as necessary. For instance, patients who require kidney operations or liver surgery can have the same procedure together with heart bypass operation. And a lot of people think that this is very high risk. But in my view, if done correctly in the right sequence, with proper precautions and so on, the risk of the combined surgery is really no different from the risk of a complex heart surgery operation. The advantage to the patient is that he can get is especially the case for people with vascular problems, say for instance people with carotid artery disease, carotid artery stenosis, or even an aneurysm. There's a ballooning of the aorta of the chest or the abdomen. There is an advantage in this situation to use the conventional heart surgery procedure, that is making use of the benefits of cardiopulmonary bypass to control bleeding and also with some degree of cooling protect the organs, for instance the kidneys. Because with cooling of the patient's temperature, the organs can survive better when the blood circulation is cut off. So for instance, during major operations that require clamping of the blood vessels during the procedure. No doubt there is a risk of bleeding from the operation, but this risk is similar to complex cardiac surgical operation. So when patient needs major surgery and are found to have severe heart disease as well, it is feasible, depending on the condition of the patient and so on, to combine both procedures in the same sitting with reasonable chance of success. That is, this 2-in-1 operation probably, in many cases,